Hello, good day and welcome to Yes You Can podcast. I'm your host, Tammy Ukwen, and a lot of us have been wondering, what are the career perspectives in anatomy? Do anatomy just work in the mortuary? Do they just lecture after education? What of those that are unable to lecture? What do they do with their life? Does it mean they are jobless? These and more we'll discuss on today's session of anatomy myths and misconception debunked. We also have a lot of beliefs in our system that a lot of changes that happen, and then we believe these changes are based on traditional perspective. This and more will be trying to clear out the way in today's session of Yes You Can podcast. So either if you are a student, a teacher, a layman, this is for you. So today I have a very wonderful personnel with me in the studio who is an anatomist in the making. He's going to introduce himself to us. I have seen his level of rigorous studies when it comes to the field and his dedication to the field. I'm in the studio with
Kokoiwen James Kokoiwen, a 200 level student of Department of Human Anatomy, Federal University of Taraba State.
Okay, before we even start, Mr. James, you got admission into Federal University of Taraba, into the Department of Human Anatomy. Is that really what you want to study?
No, actually, I wanted to study medicine and surgery.
Okay.
But due to a few reasons, I found myself here. But I took this as an opportunity to do my best.
Wow. A lot of people have gotten into this field, and at some point they begin to have regrets. Why might they anatomy in the first place? But sometimes destiny has it that the place you think you are destined to be, God has something bigger for you in another way. So I believe that you coming to the field of anatomy, it's really a wonderful thing, and it's a blessing to us in the department. So we'll be starting with career perspective in anatomy. So the moment you got admission into the Department of Human Anatomy, do you have any experience where people have talked you down about the admission?
Several times.
Okay.
Several times.
The
first time I got admission into this place, Department of Anatomy, I told my friend, and my friend told me I'm going to be a mortuary attendant.
Wow.
That was the first thing she said.
Mortuary attendant. That really sounds so delusional, because looking at the field that we're coming now, you see, these are some of the myths we're trying to debunk here. So is that the only thing they told you, and being a mortuary attendant, like that's your career perspective and nothing more?
Few people said I want only on job as a lecturer, or even as a secondary school teacher who is teaching biology.
Wow. A lecturer or a secondary school teacher teaching biology in the field of human anatomy. Well, that is the misconception we've been talking about. For years now, the human anatomy field, especially in Nigeria and in most part of Africa, has been looked down on to a field that basically talks about the morgue. You only work in the morgue where you beat the body, you comes in, comes out. I remember as of that time. So what was your motivation to still be able to carry on with the studies and being here to this time?
I had to check the career perspective after studying anatomy, and I got many of them. So I decided to come, do my best. Since there are other careers, I can still do better in the society, even when I graduate from here.
So what are some of these careers you think an anatomist can really work in, apart from what people have said, the work and lecturing jobs, either in secondary school or in the tertiary level?
I watched several movies, and even in the society, when people die, they want to know the cause of their sickness, their death, or even identify their death, the dead ones.
Yeah.
They bring them to people who are professionals in anatomy department, that's in forensic. They try to get the cause of that person's death. The person is not living, the person is already dead, but you know the cause of the person's death, even after death.
Okay.
You get?
Yes. Okay, that's like, what do you call it?
Called autopsy.
Autopsy,
in forensic sciences.
Wow, in forensic science. So it means anatomists can have a career in forensic
Yes.
science too.
Yes.
Is there any other field? Because this is just one. I think there should be more.
Looking at this is a model.
Okay.
This is a model. An anatomist is somebody who studies about the human body.
Okay.
They study microscopically,
okay,
embryonically, and even the gross, what you can see.
Okay.
Now looking at this, it's me looking at this. I can open this now.
Wow.
And get to understand how the human body is made.
Okay, this is really an intricate design.
This has been designed by an anatomist, somebody who has really studied the entire system of the human body. I'll get to look at it. Now, I don't need to look at your body to dissect you before looking at it, before learning it. I'll just look at this and I will know this is the lungs, this is how it is positioned in the thorax.
Okay.
I'll get to understand that this is the heart. Not just this, I can even go inside and look at how the heart is made.
Wow.
In the interior.
Wow.
The lungs, the diaphragm,
okay,
the bronchi, the arteries, the veins, and everything. Coming down to the abdomen, you can see how the intestine, everything is made. This is the work of an anatomist. Wow. He has made this model because he has the knowledge of anatomy. Okay. He has the knowledge of how the body is built. He has the knowledge of how the structure is. And he has done this for what? For student learning.
Wow. 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 So for you that are out there and have been thinking, well, why will I even come and study anatomy in the first place? I just want to have gotten admission in anatomy and maybe you have even graduated. You don't even know what to do with your life. But there are a lot of things you can do. Not just with your degree, but with the knowledge you're able to acquire back in school. Because the university gives you an opportunity to interact with a lot of like-minded people like you, or people who are even of having a greater mind than you. So these people that you interact with tend to give you an upper hand when it comes to the society and things. So now we are going to our next segment. We're going to dissect the aspect of career prospective anatomy. Now let's talk about your body system. You know, there's this belief that Africans have, and not even Africans, a lot of lay people have that what is causing ulcer is eating too much pepper. You see, things like that. They say when you eat too much pepper, it causes ulcer. And some people even have it that ulcer is not in the stomach, it's in the chest. So can you tell us where ulcer occurs and what are they, if they are causative agents, and how can we mitigate this as an anatomist?
Getting this model, I'll try to get the stomach. Okay. So this is actually the stomach. The stomach is in the abdomen, wow, though it's housed by the ribs, because the ribs come down, okay, separated by the diaphragm.
Wow.
Now this is the stomach. This is where the esophagus enters, and this is where it enters the small intestine. Let me open to the interior. This is the interior of the stomach. Okay. The muscles are there. Okay. It's this, what you are seeing here, it's called rugae. Okay. And these are the muscles inside. We have a circular muscle and then the longitudinal muscle. Now, the ulcer you are talking about happens and occurs in the interior of the stomach. Okay. What is the cause? There are some acid that is produced to the stomach. Okay. This is for digestive purposes, and the acid is hydrochloric acid, which is produced from the gastric enzyme, the gastric glands. This hydrochloric acid the stomach, the lining of the stomach is resistant to that acid. Now, if there is no food in the stomach, okay, the gastric acid is being produced, which is hydrochloric acid. It gets to what? To eat up or wash the lining, the mucous lining of the stomach. Okay. Thereby removing it, which is resistant to the hydrochloric acid. And then it gets to the muscular layer of this. Okay. Thereby causing the ulcer, which we call
peptic ulcer.
Peptic ulcer, yes, which is called peptic ulcer.
So what you're trying to say now is hunger causes ulcer?
Not really hunger,
Okay.
but
is hunger like one of the causative agents? Let me use this word, causative agent for ulcer.
yes, hunger can be a causative agent, because when there is no food, but there is production of hydrochloric acid, the hydrochloric acid tends to eat the mucous lining of the stomach, thereby exposing it to the acid, which now gets to remove the muscular layer of the stomach.
Wow.
Another cause of the ulcer is Helicobacter pylori. Helicobacter pylori is a bacteria that is in the stomach. What it does is it also eats up the mucous lining of the stomach.
So that means this bacteria, the acid cannot digest them.
This bacteria is the stomach is actually acidic. It is acidic. It has low pH. But for this bacteria to live and be able to adapt to this environment, it has to be acidic, to be basic. So this bacteria, Helicobacter pylori, is a basic bacteria. So it is there, and it's what neutralizes the acidic environment so that it can survive, and it carries out its activity by eating the stomach lining.
So in the first place, how did this bacteria even get to the stomach? Are they contagious kind of bacteria? Is there any way you can't contact them? Because from a study I saw a few times back, I saw a study that when somebody has an ulcer and used eating utensils and left it unclean, and somebody that does not have ulcer decides to use that utensil, there's possibility that this pylori bacteria may be present in the saliva, but the saliva still goes to the stomach. I think maybe that's how they got to know about it. So when you consume this, you get to the stomach, and you also get infected with this bacteria. So how does that really? I don't know.
Helicobacter pylori is a bacteria, as we have already mentioned, but it's not contagious.
Okay, it's not contagious.
You cannot use utensils with somebody else and then the bacteria will be transmitted. No.
Okay.
It can't.
Okay. There's also this video I watched of recent. All of us, I guess, were familiar with Apricot Doctor, and it's a video of a woman who said, if you want to drink alcohol, eat liver, so that when the alcohol gets to your stomach, it will be confused on which liver to attack. So what is your take on this misconception that this particular individual has come to the internet to give people about the liver and its detoxification effects when it comes to alcohol, and also relating to hepatitis?
It's actually funny to get to understand that somebody said you should eat liver,
yes, so that
before taking alcohol, so that by the time the alcohol gets to your stomach,
confused on which liver to attack,
on whether to destroy the living liver or the liver that has been eaten.
In digestion process, yeah.
Actually, that is a myth, and it must be corrected.
Okay.
This is the liver. It's just found after the thorax. Now, by the time you take alcohol is usually absorbed even in the stomach. Yes, it's absorbed in the stomach, and it is acted upon by alcohol dehydrogenase. It can even be absorbed even in the small intestine.
Okay.
Now, this alcohol, remember, in anatomy, let me use anatomical terms a little.
Okay.
The small intestine and the large intestine is drained to the liver by the hepatic portal vein. This is because this blood here has to be returned back, and the blood is low in oxygen but rich in nutrient, and it has to pass through this organ. This is the largest organ in the human body.
Wow.
And this is the organ that helps for detoxification, and in fact it acts on almost all digested or ingested food. It has to pass through this organ so that this organ can actually finish the digestive process. When this alcohol gets to this place, which is the liver, it affects the liver. So you can't say eating liver to be in the stomach and then taking alcohol will make the alcohol to be confused. No, it cannot be confused. You have eaten the food, you have eaten the liver, and it's as if it's a normal food.
Okay.
So the cells are not even living it will still affect the liver, and it will cause liver cirrhosis, where you have a liver problem, your liver will be diseased, and it causes a lot of things. You have a bulging stomach, it gets big, and your liver will not be able to detoxify some nutrients. Ammonia will be accumulated in the body, and ammonia, which is it's a waste product of which is gotten from amino acid metabolism.
Okay.
It's very harmful to the body.
Wow.
Even in large quantity, it's very harmful to the CNS, that's the central nervous system. So if the liver is not capable of detoxifying the ammonia, converting this ammonia to urea, which is now excreted in the body, from the body as a urine, then you have so many disease conditions, and liver cirrhosis is one of them.
Wow. So we have talked about the stomach, the liver, because I want the viewers to have a clearer understanding. This is what an anatomist do. So from this perspective, you discover that you even broaden your, apart from the career perspective, where they tell you work in the morgue, for somebody to be able to sit down and talk about the human system bit by bit, because I want us to talk about almost all the system we can be able to touch today. I don't want us to take time, but we'll try to see how we can be able to cover all this and then relating to the needs that we have. Okay, now there's a need. Let's come back to nutrition aspect, because in anatomy we study the structure, and this structure has to do with both the how food are ingested, right, and the nutrient balancing and everything. So we have this myth in Africa that eggs are meant for adults, gizzards of chicken are meant for adults. There are particular type of meat that children are not meant to be given. So when I was having a discussion earlier this morning with somebody, it's like, yeah, they need to stop kids from taking some stuff. I was like, okay, if kids are to stop from taking some stuff, then the parents have to set out boundaries. Talking about boundaries like it is like alcohol. A parent cannot give a child alcohol. No, what you try to do is, I think they should try to give them the basic diet. So now, talking about this gizzard and all, so what is your own take in African parenting and their own take or perspective when it comes to ingesting things like eggs and that gizzard in chicken? So how can you relate that to the nutritional aspect in children?
Gizzard is a meat, a normal meat, okay, proteinous in nature, and the egg also is a normal protein. Now, although there are specific food that should not be given to children because of their development, but then it has added to it some traditional meat. You can't say you will not give a child gizzard. What makes the gizzard different from the normal meat? Nothing. A child can also eat the gizzard. The child can also eat the egg, but it is also mindful to understand that the egg should not be consumed in large quantity, because the human body usually eats, digests, and then needs as it only absorb just an egg per day. Okay. So by the time you eat a plenty egg, it does not digest the others. It gets out as a feces. The same thing in children. The children also need this egg. They also need this gizzard. That is a traditional myth. Though there are also specific food nutrients or specific food that should not be given to children. But this of gizzard and egg is a traditional myth.
Okay, one of the myths that I came to realize of recent is I was going through the internet and I discovered that people are saying when you crack your knuckle, like something like this, it causes arthritis, right? So how was this? Is that really the cause of arthritis?
Oh, if that should be the cause of arthritis, then you should also have arthritis.
Yes, of course, because I just...
And then I also have it, and everybody else will also have it, yeah, right? But by the time you crack your knuckles, it's just it's called just the synovial fluid between your joints that's making the pop sound. It does not cause arthritis. It does not cause any joint problem. In fact, it's part of exercise. But you can also have a problem only when you overstrain it. But then by the time I just do this like this, that's not giving me any problem, no joint problem, no arthritis. So that is actually a myth and must be debunked.
So it doesn't have
No.
any relationship with arthritis?
No relationship.
Wow. No relationship with arthritis, down to the stomach, to the liver. And now, I want to discuss something more important. That's the heart. Yes, and I also want to relate it to when you're talking about ulcer. There's something that when they have this ulceration now, they kind of feel my heart is paining me, or my heart hurts. So with that, like, is it the ulcer that causes this heart burn, or can we also diagnose it to other heart ailments?
Talking about the relationship between the ulcer and the stomach, I'll have to put this model back and give the relationship between the ulcer and the stomach and the heart. So, the heart is located in the thorax, and the stomach is related or located in the abdomen. But then on the stomach, we have something we call the cardiac notch.
Okay.
But actually, the stomach and the heart are not in contact because there is a diaphragm in between them. But then there is a notch here in which the apex of the stomach tries to push down the stomach. Now, there is a valve here. We call it the lower esophageal sphincter. This sphincter contracts so that food from the stomach cannot go back into your esophagus after it has entered. In pathological conditions, you can have gastroesophageal reflux, where the food that has entered the stomach goes back into the esophagus. Now, remember that when food enters the stomach, it is mixed with hydrochloric acid and some gastric juice, going back into the esophagus, where the esophagus is not having the mucous lining that prevents that hydrochloric acid. Unlike the stomach, it can cause that sensation that we call heartburn. It is actually called pyrosis.
Okay.
So you now say you have heartburn, but it's not actually heartburn, it's called gastroesophageal reflux. Its only relation with the heart is that it is close to the place, and then you say you have heartburn.
Okay, that's like a referred pain.
Yes.
Okay. So now let's talk about the eye. We have this another myth. I remember when I was still in primary school, sometimes I reading under low light, and even back in secondary school, when I don't charge my lamp, I read under low light. And my mom would be like, why are you doing that low light? Into that, you spoil your eye. In a very short while now, you start using dedicated glasses and all. So how does reading with low light affect the eye? Does it really cause eye problem, or what does it cause that these South African parents are always on the verge of, don't read under low light, low light will spoil your eye, don't read too much, don't watch your phone too much. If you watch the light of your phone too much, your eyes will have problem. And sometimes you don't really understand what one does when he's surfing through the net and then trying to get some basic information. So how does low light affect, does it really affect the eye?
So you used to read in low light areas.
Yes.
Right? Are you using glasses?
I'm not.
You have eye problem?
No,
that's me. Reading in low light areas only cause eye strain. It will only pain your eyes because you are straining them. You get?
Yes.
But then this condition, that is reading in low light, has no relationship with having eye problem. But it is good you read in a place where there is light so that you can be able to see what you're reading and not to strain your eyes. But it has no relationship with eye problem.
Okay. Yes, it just occurred to me that let's talk about hypertension. Yes, hypertension. There's this saying that goes, hypertension is a rich man disease because the rich man eats salt. Yes, so it makes me wonder, does it mean the poor don't have access to salt? That people say hypertension is a rich man disease because they consume a lot of salt.
Hypertension is caused by different states in the body.
Okay.
different things cause hypertension, from the arterial rate, the heart rate, and stuff like that. Now, first of all, start by the heart. When the heart pumps too much blood to the body, maybe by excessive sympathetic stimulation, it can cause higher hypertension because the pressure in the arteries will be much. So has this to talk about the rich? No.
Okay.
I also have a heart. The rich have hearts. The poor have their hearts. We all have this system in our body. Excessive sympathetic stimulation now causing the heart to pump small blood is occurring in both the poor and the rich. So hypertension is not a rich man's disease. It's everybody's disease. So I've spoken about the heart.
Yes.
Now, maybe let's talk about the kidney.
Okay.
The kidney filters excessive.
I have access to it.
The kidney is actually found in the abdomen, in the posterior abdominal wall. You have, this is the right kidney and this is the left kidney. It's found in the posterior abdominal wall, and this is the aorta, and then the abdominal aorta and the inferior vena cava, supplying them. What the kidney does is the kidney filters excessive water and then reabsorbs it back to maintain water balance and even for acid-base balance. Now, if the kidney reabsorbs too much water, maybe as a result of excessive antidiuretic hormone or maybe excessive aldosterone, which is secreted from the zona glomerulosa of the adrenal cortex. This is the adrenal, and this is the adrenal gland. So in the adrenal cortex, this is the adrenal gland. This is actually the spleen. This is the adrenal gland. So if this produces too much aldosterone, and aldosterone's effect on the kidney is reabsorption of sodium. And when there is reabsorption of sodium, it creates a concentration gradient in which water is reabsorbed. So if too much water is reabsorbed, there will be excessive water.
Okay.
The cardiac output will be high. We have high blood volume, and this can also cause hypertension because there is high blood pressure. High blood volume causes high pressure. And these arteries are also resistant to some of these conditions. By the time we have high blood pressure, it tries to open up so that this can pass through. Your body is made up in such a way that almost every activity that goes on in the body is being regulated. And that's what we call homeostasis. So, hypertension is not a rich man's disease, it's a disease for all.
Yes, and also so sometimes back when I was at home, I overheard some people having conversation. Okay, they were talking about the sperm of a man. You know, there's this myth they have that if you don't have sex and then you have been gathering this semen over time, it causes your stomach to pain you. Yeah, so they were like once in a while wanting to have sex so that they can clear out the sperm. So I want to understand what you thought about this.
Not having sex causes stomach pain. Let me first of all correct this. It's not actually stomach pain, but abdominal pain. The stomach is actually up here. This is the abdomen. So anything felt down is actually called abdominal pain.
Oh.
That's the first thing I would like to correct. Then secondly, the sperm is being produced from the testis, which is located outside in the scrotal sac. It now goes through the spermatic ducts, and then it's now stored in the epididymis. Your body is being made in such a way that you have wet dreams at regular times. Sometimes you sleep, you are not conscious. You feel as though you are having sex. It comes out. You can't tell me you don't have sex and you're having abdominal pain.
So okay, talking about that dream now and all these things. Can I call it spiritual? Is it spiritual problem?
It's not spiritual. It's not spiritual.
Okay, it's a biological
process. It's biological. And you can't have abdominal pain because of sperm accumulation. I overheard some boys telling the girl that they need to flush it out, or else they'll be paralyzed, their leg. They'll not be able to walk again. It will affect their legs. So they need a place to go and deposit it.
Well, this is getting funny for all the listeners. You have heard it. In as much as you have the sperm for a man, there's no point it causes this abdominal pain, as said by the anatomist. It cannot cause this abdominal pain, so it's just innate. Okay, there's this saying that says, "What you believe, what kills you." And if you're talking about this belief and what kills now, it just occurred to me that for somebody now that maybe he has been taking alcohol all his life without having knowledge of the liver detoxification and liver sclerosis, right? And he continue taking this. That's because he's ignorant. So you get to a certain point that when there's an information that, okay, if you're taking alcohol, this is what it does to your liver. It causes damage to your liver and other parts of your body too. So the moment that information is passed out, it looks as if that individual now tends to start having this kidney disease, this liver disease. And so is it right for me to say ignorance is bliss when it comes to this aspect of awareness about stuff like this? Or shall I say ignorance is not bliss, ignorance is a curse? Because I've seen in most case scenario where somebody does not even have, let's say, he may have been experiencing some enlargement in his arms or something. Let's talk about the women now. In the case of breast cancer, maybe the person is not aware that this is really a sign of breast cancer, but because of ignorance now, the person has no knowledge about this. So sometimes they will see it as a spiritual problem. But as time goes on, when the person information is passed out and the person gets to know more about it, the person system begins to shut down completely. What really caused that?
Maybe that should be as a result of sensations. Maybe before your awareness, you were not sensitive to the degradation that was occurring in that particular system. Okay. But because now you are aware, your system is now more sensitive to that particular thing. And then some people, maybe their emotions can also cause it.
Okay, so it's
now
like
they are aware.
Psychological.
Yes, psychological. Now they are aware, and then maybe anxiety or something is now making them to
think about.
Yes. So in that case, now they will have excessive thoughts about the effect of that particular disease on that particular system, which sometimes does not get to that point, and sometimes gets to that point because already the disease was there.
Yes.
The disease was there, and then it was causing harm, but they didn't take it serious because they had no knowledge of it.
Ignorance. Yes.
Because that's the ignorance. But now they are aware, and then the effect is now very predominant.
Because I have been seeing a lot of posts, and then let's talk about this breast cancer now, because it's one of the major problems now we have in healthcare system as relating to the female aspect. Because from the study I've seen earlier, there's this saying before that cancer is a white man disease. Because they believe that the black man has melanin, so the melanin protects us from the harmful UV rays of the sunlight. But now it's looking more predominant even in Africans that we have a lot of cancer cases. I'm going to talk about the breast cancer, the brain cancer, and in every part of the body. Anybody tends to develop cancer now. So is it really the melanin that protects we Africans from cancer? If we really protect us, we Africans from cancer, does it mean that we have evolved over the years now, that this melanin has degraded, that we are now having these cancer challenges?
We have to fix this before I answer the question. And I'll answer the question about the cancer on different organs. So I want to first of all start with the breast cancer. The breast is a prominent structure found on the pectoralis major and the thorax.
Okay.
Now, this is the breast. This breast, the skin has not been removed. Why this? The skin has been removed. Cancers are usually spread through the lymph nodes and the lymphatic vessels. This is because these are this is the system in the body that helps to drain and in fact, should I say, fight against this bacteria and even this disease causing agents. We call it the lymphatic system. And the breast is very highly supplied and drained by the lymphatic system. Now, by the time you have breast cancer, maybe, and then remember that cancer are just normal cells, but these cells have undergone mutation. They have changed form. In that case, they are now harmful to the body. So we now have this breast cancer here in the breast, but then these lymphatic vessels go to different parts of the body, like the breast now. Lymph from the breast is drained to the axillary lymph node. Okay. Now, if you have breast cancer, it can also pass through these lymphatic vessels to the axillary lymph node in your armpit. We call it the axilla. Going there. While some can even go to the infraclavicular lymph node, others can go to the parasternal. And then this is how this breast cancer will now spread. Coming to blood cancer, which is called leukemia. These cells are in your body, they are in your blood, they move, and I've heard of people going outside the country to go and change their blood.
Yeah.
Yes. Then when you talk about the skin cancer, you were talking about melanin. Actually, melanin is synthesized from tyrosine, gotten from phenylalanine. And when tyrosine has been synthesized to melanin, it gives the pigmentation of the skin. That's the dark pigmentation. When you see fair people, you say they are albinos. You see albinos. Yes.
Yes, I've seen.
Albino is as a result of the inability for the tyrosine to be converted to melanin by the enzyme called tyrosinase. Now, people, the action or the importance or the function of melanin is for the protection of the body against UV rays and some other things. They said skin cancer was actually for the white man. Yes, somehow true, but even those who are dark in complexion can also have skin cancer. The reason I have agreed to the fact that it's also the white man's disease is there is low pigmentation, and the function of melanin in the skin is for prevention against cancer and for UV ray that's coming from the sun. So exposure to this UV ray will now cause the cancer. Why in black people or dark people, like Nigerians, we have excessive, like look at me, I have excessive melanin. So it will be quite hard for the UV ray to enter through my skin, even when I'm exposed to it. But when I'm excessively exposed to it, I can also have the cancer.
Wow. Okay, I think we have spent a lot of time to talk about a lot of systems. Now, to try to draw the curtain close here, but the hearing this one that has taught me for quite some time now. If you watch most Nigerian movies, when a woman is giving birth to more of a girl's child, they blame her that she's the one that is not giving birth to male child. So is it the woman that is responsible for the male child, or who is responsible? And how can we mitigate this myth about when you're having too much female child is because of your wife? It's not the man's fault. They always blame the women for having a lot of male or female children. Maybe you have like 5 male children with no female. Post. Yeah, talking about one of the myths I came to realize before we draw the curtain close, is the fact of, if you watch a lot of Nigerian movies, they are now doing like a man will even send out his wife from his house because she only gives birth to more of male children. Or maybe she gives birth to more of female and is interested to having 1 or 2 male. So decide to send her out and remarry new one. So are women really the cause of you having more male children or more female children? Or who are going to be responsible for all this?
So that's actually the embryology part of the anatomy now.
Okay.
Oh, so the ones we were talking about was actually the gross
Gross,
part. So now you have taken me to
The embryology.
the embryology part. Now, the chromosome of female is actually XX chromosome, while that of a male is XY chromosome. Now, if a female has XX, the male has XY. During fertilization, these chromosomes are exchanged, and it depends on the sperm being donated or the sperm that fertilizes the egg. You send your sperm, the man sends his sperm, it's an X chromosome. Already the woman has all its eggs as X chromosomes. Or sorry, having X chromosomes.
Yes.
Now you send your sperm. If it is an X chromosome bearing sperm, fertilizes the egg, that's XX, you give a female.
Okay.
But when it is Y, fertilizing an X, you have XY, which is a male. Now, when you have a woman giving birth to males, that's as a result of XY, the man donating the Y, which is fertilizing the X, and then when you have a female, that's when the man donating X, fertilizing the woman's X, and then having XX. So the main determinant of the sex of the child is not the woman, because the woman is dominant, just XX. It is the man
That has a capability.
that has the
Defining factor.
the defining factor,
Okay.
either to donate X or donate Y, though it is not voluntary. Yes, you don't pick your X and then you drop it, no. But it depends on the ability of this X or Y chromosome bearing sperm to fertilize the egg that determines on which sex the woman or your wife will give birth to. So people sending away their wives out because the woman is only giving birth to females, it is you, because you are donating what? X. So when your wife is also giving birth to a male, it means you are donating what? Your Y. Your Y fertilizing the X, you have XY. The man donating X, fertilizing the X, that's XX, which is female. So the man is actually to be blamed. Not blame actually, but should we say it is the work of God?
Yeah, faith. It's just faith. Faith determines everything. So, ladies and gentlemen, we have talked a lot today in the aspect of the anatomy myth and how we are trying to debunk some of these myths that we have, especially in Nigeria here and globally, in Africa and even in the global world. So today we have discussed a lot. So one more takeaway thing I really want us to have from my guests is we have students that are going to write down. It's a continuous process. Education is a continuous process. People will keep on applying school, and then there are also people that are still in school. There are people that are fed up with the anatomy they are doing. They just wish they want to change. I want to change to MBBS. I want to change to this. So what advice are you going to give to people who have found themselves in the field or who are even have passion for it, but because people have talked them down, anatomy is only working in the mortuary, they have decided to deter that dream, to dim the light of their dream, and they are no longer living their dream? What message are you having to those people? Starting from the stomach to the liver, down to the reproductive aspect, and to the eye, and to the heart. So we have touched almost most of the basic system we'll be able to touch today till our next subsequent episode, where we may likely discuss the rest of the system and some of the myths surrounding them. So, Mr. James, if you were to give a take-home message to anatomists who are already graduates, who don't know the way forward in career perspective, anatomists that are still yet in school in the making, who are still students and are trying to, by all means, change because of the negative message they have heard from people. They are trying to dim that light of research and understanding the intricate design of the human body system to living up to other people's shine. So what message are you going to give to these people who are in school right now studying anatomy?
So, learning is a gradual process, and we learn every day. So for those watching out, I'll give them a few advices and some career prospects you can have in anatomy. Yes.
But I wish you can also I really see.
All right. When you study anatomy, you can work in forensic sciences. I've said it before, where you know the cause of someone's death, even after the person is dead, by getting to know about the tissues. That's in histology. You learn this tissue, and then you use the knowledge you have gotten to know the cause of the death. So you can also work with these forensic centers where they try to get investigations and stuff like that. Now, I've already said it too, that this model has been made by an anatomist who knows the structure and how the human body is built. So, you know how much this costs?
This
is very expensive. Looking at the lab, you go to labs, there are more of this. An anatomist can do this. Now, when you come to vaccine efficacy, an anatomist can give orientation and awareness to people on the effect of this vaccine to the body and how the vaccine is not toxic or not harmful to the body, because he has known the structure of the human body and he knows how much these vaccines are going to work in the human body. I don't know if you understand. Now, as an anatomist, you can also work in research centers where you can find more things about the human body, maybe how this works, maybe you take a grass, you eat grass, how that grass works in your body. A particular herb, you boil a herb, exactly, in pharmaceutical industries. How a particular herb can work in the body, or which of the body organs or which of the body parts this drug or this herb has affected or its targets. Because when you take drugs, there's a particular organ in the body that is targeted. So an anatomist, you don't have to say or to hear people telling you are going to end up in a morgue, wash dead bodies, take dead bodies, take care of them. No, you have more to it than taking care of the dead.
So we've heard a lot of things about the career perspective in the field of human anatomy. So wherever you are feeling down because you have taken your time to study the human anatomy, the human body system as a course in the university, or you're still in the university and then you are feeling down. Look, there are a lot of career perspective. You can pave way for yourself also. So from all of us at Yes You Can podcast, I am saying yes you can, yes you will, and yes you must. Your dream is achievable. It's just left for you to make the right choice today and live up to that dream. I remain your host, Tammy Ukwen, and thank you for joining us on today's session of Yes You Can podcast. See you next time. Bye.